In this podcast, we'll wrap up Chapter 1, an introduction to OEC. In particular, we want to focus on the legal terms that we see here with Objective 1.7. Principally, we need to distinguish between types of consent. So when we look at patient consent, the first type, most commonly, is just to understand that informed consent is when an injured person understands what you're about to do to them, and it's a competent person who understands what actions you plan to take. If the patient says, yes, please assist me and render first aid, then they've given expressed consent. And by rendering first aid, and if the circumstances permit, you can actually continue that consent process by saying, for example, I'd like to put your leg into a splint. Is that okay? And they've continued to provide their express consent and agree to the treatment you're rendering. Once again, if the patient is competent and says yes to the treatment you render, you've obtained expressed consent. Okay. Now, it can get a little sticky, okay? It can involve both expressed consent and refusal of care. It may be that you initially receive consent to assess the patient. Oh my gosh, you've got some tenderness here in your ankle. It looks like possibly that is a sprain. I'd like to put that in a splint and transport you to the first aid room. The patient may say, yep, I agree, it's sprained, but I don't want you to put a splint on it. There we have expressed consent for you to assess them and offer the results of your assessment, but they can refuse the care, they can refuse the splint. Now, another type of consent is implied consent. If the patient is not capable of providing expressed consent, maybe they're unresponsive because they struck their head in a particular ski accident, then you may operate under implied consent. That implied consent allows you to render first aid in a legally appropriate way. Now, another issue that can get tricky is if a parent or guardian is not available. When we're dealing with minors, pediatric patients, it has been determined that because of their minor status, they may not be able to provide expressed, that is, an informed kind of consent. So in that case, you need to contact a parent, legal guardian, group leader, or a chaperone who may have a written agreement from the parent to allow treatment to occur. Use your good judgment. Try to contact that parent or legal guardian in order to render assistance to that minor. Now, in any case, a patient may refuse care. Allowing that injured person the opportunity to refuse first aid is important. If you persist, you may be guilty of assault and or battery if you actually touch the patient in that case. Let's look at a little bit more detail at that. If you place a person in a position where they fear that battery may occur, you have committed assault. If you actually touch someone who does not desire to be touched, that's battery. In either case, it could lead to either civil or criminal offenses being filed against you. Now, the use of physical force is rarely justified. You may encounter someone who is under the influence or some sort of altered mental status, and in that case, maybe your best pathway is to step away, notify law enforcement, area management, or security, and look for additional help. Let's wrap up Chapter 1 with just a quick discussion of some of the EMS system regulations. There are different states within the EMS where certain types of medical procedures may not be allowed. We can focus only in this course on the National Ski Patrol's standard of training OEC. It is important to understand the level of care that you can provide based on your location, your state or local area's laws and regulations. When you transfer a patient, be advised that typically that transfer needs to go to a higher level medical provider. A ski patroller can hand off to an EMT or a paramedic. That EMT or paramedic arrives at the emergency room and hands off to the MD, the doctor that's in charge in the emergency room. At each time, part of the essential handoff is going to be the communication and the reporting that occurs. In all cases, we need to be respectful of the patient, and we see the Health Insurance Portability and Accountability Act, which we just call HIPAA, is designed to keep medical information about injured persons private. Now, it may exempt someone who is operating in a volunteer patrol capacity. However, if you are a paid patroller, you definitely are subject to HIPAA requirements. Now, even though a HIPAA requirement may not cover a volunteer patroller, it is ethical to keep private any information you obtain from an injured skier.